When I go in a room, I like to think that I don't have a big agenda on where that visit will go or what happens for that person. It's really the art of creating a space where that person feels safe to speak what they need, what's important to them, what's in their heart, and then responding to that. When they feel safe, when they feel cared for, listened to, affirmed, that has a lot to do with them getting better.
Currently, Joey is taking a medication that has to be monitored every 6 months because of the side effects it could have due to his emotional disability. So that's why we come in and do blood work here at the hospital.
Sarah wanted to meet the needs of her child, and that she was finding it very difficult to do that because of past circumstances.
The first lab we went to told us to leave when Joey started to cry and kind of freak out about the idea of blood work. They said he was scaring the other patients, so we left. We went to another one and they wouldn't help me hold him down to get the blood work done.
You can have faith and you can have the medicine side of it, but I think the two, when you put them both together, it works out well.
We are a service ministry, and that's what we do.
I called the hospital and they directed me to the third floor lab, and Carol's who I spoke to, and she's like, bring him on in, we can do it. So it was relief.
In the laboratory setting, we may not always have direct contact with the patient. In this case, we do. We tried our best to make him comfortable. We knew it would be unpleasant because of his past experiences. So we had plenty of staff on hand in case we needed to hold him, and we did have to hold him.
Chaos.
How so?
I did not want to get my blood taken. I did not want to see that needle. I hate needles.
My first approach was to make Joey feel comfortable and to gain his trust.
Because if I didn't trust him, then I wouldn't be here. I'd probably be running about the building.
My personal faith in God has helped me to really treat individuals as you want to be treated.
He's always talked to me and asked me nice questions and asked me how I'm doing and if I'm okay.
We help contribute to Joey's emotional well-being as well as his medical well-being. Each specimen is a patient, and we treat it with the respect.
They put patients and family first. It's nice where people don't look at us like we're a burden to have to help.
You can have the knowledge to do the science, but I think you still have to be a person with a good heart in order to make those things work together.
My dad was admitted to the hospital on a Friday morning. They both live at Broadway Plaza in assisted living. He has always taken care of my mother, and she was admitted to the hospital on Sunday morning, and she was very, very, very sick.
My partner was taking care of Mrs. Truitt, and I was taking care of Mr. Truitt. And when I learned that she wasn't doing very well, I knew that this would affect him greatly.
They were married 66 years, and there was no way that he would be able to leave her side.
That put into motion the physician and the nurses recognizing the need to go ahead and implement palliative care and try and get her with her husband as soon as possible.
And the compassion that they showed us in making this happen was tremendous.
I know each day when I administer care, I do it, it has to be equal to everybody. But there are situations where you go an extra mile to administer that excellent service.
They met at a gospel singing in West Texas when they were teenagers. Gospel singing, hymns, And faith has always been a big part of their life. And they instilled that into me and my brother and sister. Take it to the Lord in prayer. They moved my mother up to the 4th floor in one of these large rooms and moved my dad up to the room next to her. The whole family was here, and we took my dad into the room with Mother. And before that, Dad was very anxious of wanting to go see her and take care of her. Mother was fighting death, and she was gasping and, moaning and not real responsive to anything, I think, but pain. And the nurses took him into the room in the bed.
He wanted to stay close, so I had to pull the beds together so that he can touch her. He was so agitated, and I realized when he did that, the wife became calm, and he started praying for her, and I was just filled with tears.
When the two were together, they did so much better, and you could see a lot of the stress, fade away.
He said, can we sing some hymns? And so he started singing hymns, and he remembered every word of it. And so the rest of the family also started singing. There were 2 nurses in there. Everybody was touched. And I can tell you without a doubt that the presence of the Lord was there.
It was a generational family of faith, and they were well in control of their spiritual walk, their journey. And as Texas Health emphasizes, body, mind, and spirit are one. We need something from all of those things to be able to be whole persons.
66 years ago, my dad and mom said hi, surrounded by hymns. And because of what this hospital did and what they did for us, they were able to say goodbye, surrounded by hymns together.
I think that those are the moments that, as a physician, that you strive to achieve.
They ended up having to move them to Broadway Plaza, my mother under hospice. My dad was discharged, but we made it happen to where they were in the same room over in Broadway Plaza. And Mother passed away, maybe 6 or 8, maybe 8 hours later. But, the faith aspect, once again, has been our rock.
It doesn't matter which faith we're talking about. We have to recognize how important it is.
We didn't come here because of the faith-based attitude. We came here because it was close. But from now on, I would, recommend this hospital because of the way that they incorporate faith and healing.
These are the patients that you will remember forever.
This experience with my parents is something that my family will never forget, ever. Thou wilt find solace there.
On the very first day, as a new volunteer, you're taken around the hospital. The first place you're taken to is the chapel. It speaks a lot to the organization in regard to being faith-based. I remember being asked to come and sit with a gentleman that was here, that was a patient, and he was dying.
During one of my visits with him in the room, just kind of mentioned, I'm not afraid of dying. I'm just really kind of afraid of not having anyone there with me and being alone when that happens.
A sense of loneliness, a sense of isolation, and if we could help alleviate that part of the suffering, then that was important.
And we talked about how if he had anybody who could come, any family, any friends, anyone that, he wanted us to contact for him. And, there really wasn't.
I then talked to the volunteer coordinator and said, we have this man who's dying. He doesn't want to die alone. Do you have any volunteers that you think might be interested in something like that or might want to engage in something like that? And she said, Barbara.
I believe that every person needs personal contact. I walked in the room. He was not conscious. He just had the look of a very sick man. And so when I came in, I went over to his bed. I had his name. I spoke to him, and I touched his hand, reached over and just touched his hand, told him my name and why I was there. And I said a prayer. And then I just sat by his bed and would talk to him. You never know what a person hears or feels. I would like to think that he felt that someone was with him and someone did care.
Because I think it was such an honest, humble request, it touched that part of us that reminds us of why we're here. The faith and spirit, the mind-body-spirit connection is one way of talking about holistically how all that is central to every person.
I don't think that the nurse or myself was thinking that we're doing anything extraordinary. We're just doing our job.
I don't know many other systems that would have the kind of people who would be willing to come, leave their families and things to sit by a total stranger in his last time.
I really felt honored that I was able to be here with him.
We didn't want him to be afraid. We knew there was nothing that the science and the technology and all of those things could do. But there was something that we could do as people. And sometimes that's really kind of the best part of the job.